Dr. J.P. Sawhney, I think you are an authority in the hypertension registry at a national level, and your contribution is very well known to all of us. My question to you is, please highlight in the public interest as to what is the scenario of hypertension in India, controlled and uncontrolled. And second point, which you are very fond of, is your contribution in giving a message to the masses, which is the right way to measure the blood pressure at home BP monitoring, or CBPM, what we call as clinical blood pressure monitoring, or ambulatory blood pressure monitoring. It's very, very important. People ask these questions when they come to us. Kindly express in details so that everybody understands the power and promise of measuring the blood pressure at which location, why, where, and how. Dr. J.P. Sawhney, sir.
Thank you, Dr. Chopra. Thank you, Tata Fame and IPCA for inviting me for this very prestigious meeting where we are having a awareness program for the hypertension, which is a most common risk factor which attributed to the mortality of human being on this earth. And what we found approximately in our country, around 35% adult population in the urban area and around 27 to 30% in the rural area are suffering from high blood pressure. Such a big figure. You can imagine how many people are suffering from this. And as you rightly, Dr. Kher has said now, this is one of the important, if you don't treat hypertension, then there will be chances of having heart attack, heart failure, stroke, chronic kidney disease, as Dr. Kher has said already, and even retinopathy and eye problems. So many complications comes in if you don't treat that. And normal cutoff level, which we take, is 140 systolic and 90 diastolic. But the goal is to keep the blood pressure at 130/80, which has been accepted by most of the guidelines in clinical practice. So your other question is the how to measure blood pressure. So earlier, what we used to have a traditional way of managing was to come to office of the clinics and to check the blood pressure. So that gives you a single reading. It has a disadvantage that we get only one single reading in a given time. Secondly, around 25 to 20 to 25% patient, because of the they develop what we say white coat hypertension, and they have high blood pressure in the clinic. They have high heart rate. And when they go back home and check the blood pressure, their blood pressure is normal. So they are unnecessarily overdiagnosed as a case of hypertension. So that's the reason why recent guidelines have now shown, and during COVID times, we have learned also that jo patients at home blood pressure should also be important method of diagnosing and treating and monitoring blood pressure in clinical practice. So अभी उन्होंने guidelines ने बताया कि home blood pressure monitoring से बहुत फायदे हैं. एक तो we can have a multiple readings. We have readings before medicines, after medicines. Only thing is we should teach the public how to take the blood pressure when they're taking at home. So since we have multiple readings, it बड़ा easy होता है. They can convey to us their multiple readings, and so we can control the blood pressure and adjust the doses of blood pressure lowering drugs appropriately so that they are controlled. Because if single reading in office may not be adequate, उससे मुश्किल हो जाती है कई बार. पेशेंट मॉर्निंग में ब्लड प्रेशर कंट्रोल होता है, शाम की क्लिनिक में हमारे पास आता है तो बीपी हाई होता है. तो इसलिए वो उसको ध्यान में रखते हुए home blood pressure monitoring has become now a very important part of the management of hypertension. And home blood pressure monitoring में हमने बोला है कि BP should be 130/85 as a normal cutoff. उसके लिए patient should keep normally automatic blood pressure monitoring machine use होती हैं. तो उसके लिए हम कहते हैं patient को he should sit in a quiet room. He should not take any tea or coffee half an hour, at least within half an hour before the blood pressure. And maybe sometime we have to take two readings. The first reading, and after 2-3 minutes, you can take second reading. Sometime first reading, maybe you are little apprehensive, you can discard that and take the second reading. अब कुछ instruments ऐसे भी आ गए हैं जिसमें 3 reading automatically ली जाती है, and you will get the mean of that. So those instruments are also available now, very useful to calculate the blood pressure. एडेड एडवांटेज होम मॉनिटरिंग का क्या होता है, जो हमने कोविड टाइम में देखा कि जो पेशेंट इंडेक्स पेशेंट तो पकड़ा जाता है, लेकिन घर के फैमिली मेंबर्स का भी ब्लड प्रेशर चेक किया गया, तो हमने देखा अराउंड 15 to 20% ऑफ द अदर फैमिली मेंबर्स लाइक ब्रदर सिस्टर पेरेंट्स, दोज हु आर नॉट अवेयर ऑफ ब्लड प्रेशर, they also were diagnosed. So undiagnosed hypertension also become a very important part. Coming to the second type question which you said about the ambulatory blood pressure monitoring, yes, this is also very important. जिसमें हम एक मशीन लगाते हैं जिसमें 24 घंटे में अराउंड 35 से 40 रीडिंग ली जाती हैं। इसका सबसे बड़ा एडवांटेज क्या है कि ये रात के टाइम में जब सोए होते हैं तब भी ब्लड प्रेशर लेता है, तो एक डिपिंग कहते हैं हम, कि नॉर्मली जब हम सोते हैं तो हमारा ब्लड प्रेशर और हार्ट रेट लो हो जाता है अराउंड 10% सो, बट इफ इट इज नॉट देन हम उसको नॉन डिपर कहते हैं, उसमें उसके कारण हार्ट अटैक, किडनी डिजीज, स्ट्रोक बहुत ज्यादा होते हैं जिनमें नॉन डिपर होता है। सो ये डिपिंग स्टेटस ऑफ ब्लड प्रेशर जो है वो एम्बुलेटरी ब्लड प्रेशर मॉनिटरिंग में बड़ा इजीली पकड़ा जाता है। मॉर्निंग अप से जो ब्लड प्रेशर होता है, जैसे हम उठते हैं ब्लड प्रेशर बढ़ता है, वो भी पता चल जाता है। सो एक गुड कंट्रोल ऑफ ब्लड प्रेशर जो होता है, तो नॉर्मली हम कहते हैं एम्बुलेटरी ब्लड प्रेशर में 130 से 85 ब्लड प्रेशर शुड बी देयर, रात को सोते समय 120-70 से ऊपर ना जाए। So this gives you additional benefit compared to the home blood pressure monitoring. So this will help us to not only diagnose but also treat blood pressure effectively.
हेल्थ, फिटनेस और पोषण पर पाए बेस्ट डॉक्टर्स की राय सिर्फ famhealth.in पर, और हमारी YouTube पेज माय फैम हेल्थ पर सब्सक्राइब करना ना भूलें।